So this is my Karam Bhumi, and whatever I could achieve is because of Shankar Netralaya. So he wanted me to talk on achieved, achieving, and to achieve a smooth transition in pursuit of achievement. And what captured my mind was the last three words: pursuit of achievement. Anything else suddenly strikes because I'm moving to US. We'll see that. So it's beyond degrees. It's towards a purpose. So every great journey begins with a question: what I am truly pursuing. I think that's important. Are you chasing popularity, chasing prestige, chasing money, or you are chasing excellence, impact, justice, bigger view? Medicine is more than knowledge. It's calling for transforming lives. And from resident to a researcher, from learner to a leader, this is your journey. Okay, all of you. Today is not just about publishing papers, it's about publishing your potential. So it's more than just publishing, it's something everybody need to do. You cannot shy away from there. And pursuit of excellence begins where your comfort ends. So I'm not scaring you. It's not like you don't have to enjoy life, but you have to put that extra effort. So I thought I'll cover my talk in these three things. One is pursuits of achievement, some learnings which as a postgraduate and as a fellow I had. And then third part is more of a repetition which I very recently spoke in AIOS on research publications as a resident. And I thought this is a nice forum to talk to all of you what you can do as a resident to have research publications. So let's talk about pursuit of achievement. So the moment I heard that term, suddenly came pursuit of happiness, which is a part of what we call, or we all know about, American dream. So American dream talks about life, liberty, and pursuit of happiness. That's a very common term which is used, even school children know about this. And pursuit is an effort to secure or attain or quest. So they talk about happiness. But if you look at our Holy Quran, that doesn't mention anything about happiness. What it says is that the highest thing which one can achieve is contentment. So I think both are very important. Many times so you have to be contented. The moment you feel, no, I have to achieve more, you'll not do anything. So first thing is be contented what you are doing, do it perfectly. And there are some studies which also talk about a human being will have nothing for its benefit except whatever efforts he has made. So to get that contentment, you cannot have contentment, it's not like fishing, you go and sit with a rod for 10 hours, nothing doing. You have to do some effort, okay? So then only you get that contentment. And pursuit of happiness is a basic comfort and emotional satisfaction. So I think that is one pursuit all of you should have, pursuit of happiness, correct? Probably there are more important pursuits you may look into. There may be some of them, this new generation, there is pursuit of cool. No, you want to be, nobody is going to pick on me. You want to blend with everyone. You want to be cool, correct? Just want to fit in. You want to be invisible among people. And this actually takes more effort than the pursuit of happiness, because you have to do some things which as a routine you may not do. So that's the second pursuit, the pursuit of cool. You may have pursuit of popularity. So you don't want just to blend in, but you want to be the coolest among the group, correct? You want everyone to be friends with you. And for that, you need to really spend time, money, effort, because you want to maintain an image. That's also a pursuit. So it's not happiness alone. As a human, happiness is the basic thing, but we move into many other pursuits, okay? There is pursuit of prestige. Like the moment you meet there is a postgraduate meet, and you have that prestige. I am from Shankar Netralaya, correct? So you associate yourself with something which is valuable. Shankanetralaya is very valuable. And you go future, there may be many other like this pursuit of prestige. Then you have pursuit of money, because no one works just to be happy, correct? Some work to be fit into that work, some may be working for popularity, some for prestige, but majority of people want to make lots of money. So that's also one pursuit of money. Then you have pursuit of excellence. So you want to be, these are the people who want to be number one. They are never satisfied. And they always compare themselves from what they were before. And there are very few people who try to have this pursuit of excellence. But you should be one of them, correct? Still more evolved, they want to have pursuit of impact. So it's not only they want to leave a mark on the earth. It's not just excellence, but selflessness. Very few incredible people have this. And excellence is not their goal, but it's just the byproduct. So when they work for their pursuit of impact, excellence naturally happens, correct? And then you have still more evolved Mahatma Gandhi, pursuit of justice, truth. So justice is not seen fully in this world, and they push themselves even when they know there may not be any result which they will see. They are the most incredible people, most resilient people. So there can be pursuits. So we spoke about happiness and then went about so many pursuits. But it's important to identify what pursuit you want to follow. And it's not necessary that same pursuit will be there throughout life. Various phases of life, that pursuit may change. So to achieve these pursuits, you want achievements. It may be short achievements, smaller achievements, and so it's not a static goal. Okay, it's a journey moving what we have achieved, what we are achieving, and what we aspire to achieve. And achievement depends on these pursuits. A smooth transition requires reflection, a growth mindset, and most important, as I told you in the first one, where I told about Quran saying that no, it is contentment, but everything is aligned towards efforts. And true achievement aligns the efforts with purpose. So it's always, even for reading, we say that smart reading. So not everybody cracks IIT or not everybody gets into the top thing. So there is something. So it's with the purpose. You do it intelligently. So I thought that it's important because when he spoke about pursuit of achievement, I thought there are so many pursuits which you should all know about. Next few slides, I'll be telling some of my learnings during post-graduation and during fellowship period. Most important is find a guru. He should not be just a guide. What is the difference between guru and guide? Anybody want to take it up? Let's have more interactive. So I have already written. So he shows you a path. Guru walks with you, shaping your mind, skills and values. And many times your guru may not be a perfect person. No, this happens. But you look only positive sides of your guru. Correct? And if you do that, so it's not, so at Shankanetralaya I had a guru. During post-graduation I had another guru. Before that MBBS time I had a guru. So it's good to have somebody, ideal person to look forward, and they help you in your day-to-day life. Correct? Master your craft. So when I joined my post-graduation, my dad used to say that this is a time you should learn skills. So master skills in your clinics, in your OT, and do it every day, you master that. Important is learn it the right way the first time. And I always say go by the book. So because even teachers, all of us adopt our techniques to suit ourselves, which may not be ideal for you. Like if you look at the way PRP is done, everybody has different ideas. And you just copy something, but go by the textbook. Over a period of time, you can adopt, but initially it's good to go by the textbook and learn. So master your craft. The next lesson, this again my dad taught me when I joined that, my post graduation, that aim of a doctor is to be known both among patients and your peers. So patients should know you. That's what you want at some stage of your life, and that comes only by the word of mouth. So you do good work, one patient will tell to another patient. It's a good word which can create that name. Among peers, unfortunately, because this, every skill-wise, everybody becomes same. It's only matter of time. So sometimes you feel that I have done only few cataracts, I have not done much. But over a period of time, everybody will become a good cataract surgeon if you practice cataract. I don't practice cataract, so I will not become a good cataract surgeon, correct? But to be known among peers, you have to do different. There comes your publications, innovations, that create the name. Like diabetic retinopathy in India, everybody is doing. It's one of the most common disease. But people know me because I published a lot in that. So that becomes important. So read, especially medical retina, in our retina thing, is just about reading. So the eye sees what your mind knows. So go in depth, read and read. So his dad Imtiaz was my batchmate, Hussein's dad, and we used to read a lot. I always tell that we have stories on how long we used to. So depth of studies, that's important. And ophthalmology is a good branch. There's so much stuff there, and now with the current times, you have so much information which was not there when I did a PG. And it's a very fast changing field. You need to be updated. And as Pradeep was telling, learning never stops. You need to continue learning throughout your life. Unfortunately, that's a branch you have taken. It's every branch in medicine is changing, but more so in ophthalmology. Be tech savvy. That's important. So technology is not only optional now, it's mandatory with all EMRs and AI coming into play. It is reshaping how we diagnose, treat, and connect. So embrace it. And this is the stage. So I still remember when I joined here, that was a time we had a course. I still have a certificate of that time. It was called as the EDP certificate, learning computers. Okay, PowerPoint came. So now things are different. So you have to embrace whatever new things are coming. Again, cutting. As a PG, when you join, your first aim is how much cutting I'll get here. I think and it's really, really not important. So focus on learning, observing, and be prepared when the right time comes. Doing few cases under a proper supervision is much more valuable than doing hundreds of cases. We have witnessed that. So we had some consultants who joined doing their fellowship. They were consultant at some other place, very high volume cataract surgeon. And when they started operating here, we had to send them to JCOC to learn cataract. So it's important, whatever you do it correctly. Learn that. Don't be worried about that. I'm getting only 30 FACOs at the end. Shroff Charity 50, 60, 100. You will all do it. So don't worry about that. This is again important. You don't need to really make enemies, but also you don't have to please everyone. I think that's important. As a student, you always feel that whatever posting or wherever you are, you want to please that person. You can be respectful, fair, and be true to your values. Your work will speak louder than the politics. So don't get involved, because these are certain things. As a student, it's just the gossip, what others are talking, and you get involved in those things. This is again something which is very important. So how do you prioritize your work? Partho is smiling. He knows about this. Many times we have spoken. So whatever task you have, you divide it into whether on the basis of the importance of task, whether it is highly important or less important, and whether it is urgent or non-urgent. So if a task is very important and it is urgent, do it yourself, do it now. If it is urgent, but not very important, you do it later. If it is important, highly important, not urgent, do it not now, but do it sometime later. But the task which is not important and not urgent, don't do it. So if you follow that, and over a period of time, little bit this changes. When you become a bit senior, you can think of this, do it next. You can think of delegating to others. Correct? So at this stage, you cannot delegate to anybody else, but when at some stage, that can also be true. But that's important, prioritize, and that makes your time, maximum time you can utilize more productively. Change is not a disruption, it's a growth. So embrace the change, don't fear the change. Many things, it may be just the technique which is changing, or you get used to one consultant and now you're going for a new consultant posting. Embrace it and enjoy that. And that will only shape you. And never forget these 4 pillars of Shankanetralaya. So this was the quality eye care, research, community care, and academics. Why I'm telling this, till you are here, you get involved in all. But even when you go out, believe me, those 2 years when I took a sabbatical to Indore, I had in my house a board where I had kept these 4. And every month I used to tick what I have not done. See, community care doesn't mean only free cataract surgery. A newspaper article about diabetic retinopathy, something on trauma, public awareness. So you can design what community thing. It's not always, we always correlate community care with a free cataract surgery. But the moment 1 or 2 months, one tick was not there, I used to make sure that something I have to do here. So that will give you immense satisfaction, because patient care is something you will continue doing it. What you learn, that is the part of life. But other things, you have to really work for it. Correct? I'll come to the last part of the talk, where I'll talk about research publications as a resident. So what are the endpoints of doing research? Anybody? Whatever comes in mind. Publication. Yes, that's one, definitely there. For PGs, at this stage, it is what? Thesis. So much tensed everybody. You want your thesis to be out. But remember, once the thesis is out, it is published, you get, in life, you never see it back. Correct? So it's only till the thesis is not published, you are worried. Correct? The second is publication. What else? Any other thoughts? Funding. So some people do research that I do some work, there's a lot of money available. So you want to tap that money, do further research. So after this too, you think that, okay, let me write some grants. And still more evolved, you want to patent it. So these are the endpoints of doing research. So thesis, publication, getting grants, and patenting it. And today what we will be talking is about the publications, correct? Majority of time we do research not for this, but for presenting it in a conference. So already VRSI is coming, and we just look that some abstract we should make and present it there. That should not be the goal. I still remember 2005, first time, I was a junior consultant, and I told Dr. Tarun Sharma was HOD. I told him that I want to go for academy. So he said, okay, what you will present there? So I decided, I told one paper, this is what I am working on and this I'll present. He said, yes, go ahead with it. Only one condition, before you go, this should be submitted for publication. If it is not submitted, even if we have paid your registration, everything, you cannot go. And then that was a stress that I have to put it, and that paper actually got accepted in ophthalmology, because if you are submitting to AO, first journal you have to submit is in ophthalmology. And it got accepted as a poster where I had put accepted in publication in ophthalmology. So I think that should, so attending conference is just dating. The true marriage is only when it gets published. So don't leave it at that stage. You have to make sure that it's not just for the conference. If you are working on it, make sure it reaches the light, the publication. So why research publication matter? I'm sure all of you know it's an integral part of medical residency and academic development. There are benefits of publishing, lot of them, critical thinking, problem solving skills, and we all practice evidence-based medicine, and many times there are not enough, I would say majority of time there are not many evidences, and you create evidence, you really feel proud. Whatever evidence you have created, and if that is practiced by many, that's a proud moment. And it increases the academic and career growth opportunities. Wherever you will apply, you already have 10-15 publication. First thing they will see that, okay, this fellow to take for fellowship, this is the ideal candidate. You should look beyond thesis. It should not end with submission. Publication is the key. And definitely other achievement, like you can have networking, future academic roles. Research publication does matter a lot. So what are the challenges in publishing as a medical resident? So one of the common thing everybody says, no time. Very heavy clinical load. Going to JCOC, coming at 6 o'clock, no time at all. So I think there are a lot of things. There are some time management techniques you should adopt. Allocate some dedicated research time in your weekly schedule. There are a lot of activities here which when you start your PG or fellowship, they are very intense. Ward calls or writing those duty doctor thing. But after some time it happens in spinal level. And you get enough time during those period to really work on something else. Set realistic timelines. Maybe just data collection or so it should be realistic. Don't think that I'll finish it very quickly. Nothing happens quickly because you must realize you are doing other works too. But stick to that deadline, correct? And it's not to show your mentor that I have created deadline. It's for you, correct? And use some time blocking methods. So few hours a week I'll dedicate only to my thesis or probably some research which I am doing. I'll dedicate that time. Definitely institutional support for consultants. We do have a protected research time. Even in residency program, Pradeep can think if people are doing good, give some protected time. And incorporate a research rotation. At least many of you do undergo a research methodology workshop. So focus, at least sometime you get a dedicated focus on doing research. Other challenge is lack of mentorship. I don't know whom to approach, and Shankar Netralaya, you cannot say that. We have prolific researchers at this place. So seek out a faculty, whom to approach. Track record. See people who have some track record and who have previous experience in guiding. Reach to them. Collaborate even with your senior postgraduate students, those who have published. I can offhand immediately remember one of the fellow which I had, Aditi, VR fellowship. She is now completed her residency in US. During her fellowship, she published 25 publications, all high rated. And very good clinician. So it's just that how you utilize your time. Yes, writing workshop, journal clubs are important, and you must engage PGs in the collaborative research projects. That's something which we do, but we can do more. There's also a concept of peer-to-peer mentoring, like you can form a small group. So Jay Chavlani, he was our VR fellow, did his training in, after that became consultant at LVP. And when he went for his fellowship, they formed a small group and they all started together publishing. So one is doing study, other get involved. They will also contribute in some way. And that gave him, now he has 600, 700 publications. He is a vice chair of research in one of the institute. So what I'm telling, this method, I never utilized it, but probably this is something you should think of, having research-led the research groups. The other challenge is publication fee. That definitely is one of the challenge. So you can select open access journals or a low cost journal. You can ask them to waive their article processing fee. I always used to have from VRF, Dr. Ronnie would be happy to give, if it's not funded project, they give a letter, and we still belong to many low middle income countries, so we get a waiver. Utilize that. I would say 80% you get waiver, 20% if it is really a good high rated journal, nobody will say no. Okay, go ahead with it. And especially for students, if you are a trainee, there is a special thing. You can say, I'm a student, it will get waived, correct? You can apply for grants, but again, as a student, I know you have many other things to do, but that's again one option, institutional support or outside. And if you don't get anything, you can even now have these preprint servers, ResearchGate or SSR, and there are many others preprint, where at least your work can be put, it can be even quoted. So people can cite that work before publication. Other challenge they find is that there's difficulty selecting the journal. There are a lot of other tools are there, and I'm sure there has been some research methodology classes. There are journal finders. The most important is whatever you are working, I usually put it in PubMed and see similar articles where they get published. So it's of no use that I'm doing something on some deep learning, some new network which we have used to identify DME, and I publish in clinical some journal. Nobody will take it. Or you are looking at some case series of open globe injury and you publish in some basic science IOVS, nobody will take it. So you see where it gets published, and then based on that, and now you have even OpenAI. You can put actually this is the title, where it can go. You can ask questions and it gives very nicely answers. Important to follow the journal guidelines, not going in detail about the reference managers you can use. And most important is resubmit after, one minute. Yeah, this is over. So you should resubmit if it is rejected. So that's very, very important. I remember one article which I had written. See, all your kids, you will feel that they will go to IIT, correct? Your kids, you cannot think of sending to any other college. So you'll feel your article is best, and you target big journals, gets rejected, then you gradually reduce further. Then you think, okay, IJO case reports. So you keep on reducing it. So there was one article nearly 22 times got rejected. Important is wherever it is getting rejected, take the comments, modify it, submit to next. And at that time I thought that let's try to send to a much higher journal. It got accepted there. So you really don't know. It depends on the reviewer's mood sometimes, but don't leave the article. I still remember during fellowship there were 2-3 articles which I was working on. I just left it. And after 5 years I was as a consultant, then we published it. So don't leave it. Continue working on whatever work you are doing till it gets published. Then there is this fear of rejection and lack of motivation. So have a mindset that it is a requirement. No, it's not a requirement, it's an opportunity you are getting. No? Publishing helps in the career advancement, and when you see your name in a PubMed index journal, that's a big moral booster. A good ILM peel, you will feel that you have done a nice macular hole. 2 papers got published, correct? Start with smaller publications, case reports, letter to editors. Review articles are not small, but that's also something you can start working on. Present the research in conferences. Definitely that helps. So what can residents publish? Yes, original article ideal because they have very high impact in scientific literature. It strengthens your CV, teaches you a team approach because very unlikely a single person can complete the original article, but it is time consuming. It takes 1 or 2 years to complete, couple of months for acceptance. So the key is get involved in an ongoing study rather than you start a study because by the time it will get published, your course is over. So get involved in something which is already happening. You can contribute in the form of data entry, do a good literature search. You can help in writing initial draft. So people who are research mentors sitting here, you should talk to them that what paper I want to get involved. And definitely they will give you something to work on. Case report, case series are easier. They are faster to publish and it enhances the clinical expertise reputation. Though the impact is less than an original article, but they are pretty good stuff to start. But don't start that, no, I am submitting it this case because it is for not reported in India. This is the first report from India, or it may not be reported in India, but people have seen it. Common things, that is not a thing which you should publish, but very rare disease, any association of disease not described, or rare presentation of a very common disease, you can publish that. Outcome of a novel treatment, particular outcome in some case management, you feel that this was really good. I've never seen like that, you can make. Mistakes, complications, lessons learned, or sometimes you feel this is a new disease entity, nobody has described it, you can still go ahead. So these are the ones as a case report or a case series you can publish. Systematic reviews and meta-analysis are good. Systematic reviews actually summarizes all the relevant articles, and meta-analysis is combining the data from all the studies and then you draw a more stronger conclusion. They are pretty very, very high value. It's more high valued than even the original article. It requires no patient data. But what is needed is strong statistical skills. But there are a lot of courses now, online courses, free courses available, how to do a systematic review, how to do a meta-analysis. So recently one of my old fellow, Ronak, did his VR fellowship. He did his course on meta-analysis and he's doing now meta-analysis. So these are some things you have to skills learn from the online courses and then do it. You have a question, you can do these things. Letter to editors are again short pieces, and I still remember one of my first publication was letter to editor with Dr. Rajat Agrawal. So we read one article. In the OT, he told, I read this and this is what it's not always commenting bad about the article, but he took some points, he explained, we can explain more better. And we wrote that, Journal Cataract Refractive Surgery, and I got acceptance in a week. So this was one of the first article. It's good. So often it is free to publish and it's also indexed in PubMed and very less count. So these are low-hanging fruits. So your tick in the 4 pillars, if something is not happening, take this and tick it, correct? How to choose a right journal? Make sure it is indexed. Usually we all prefer to have a PubMed index journal, but there are other things also. Is it open access or subscription based? Because it's open access, many people will read. More people will read, more will cite. More will cite, your H-index will increase, correct? Is there a publication fee? Does the journal accept? Because not all the journals accept letter to editors or short reports or case series. And where the similar topics have been published in the past, based on that you select a right journal. Avoid predatory journals. Nowadays there are many of them, and you can do an online search to find out whether your journal is a predatory journal or not. So some institutional strategies: you can implement research training programs early in the residency, encourage participation. You all are go for national international meetings. If you are really doing good, I'm sure people will provide you grants, small grants for publication fee, and most important, reward and recognize research done by a resident. And if that is rewarded and recognized, many others will do it. Resident level, you can engage in collaborative research, team up with faculty and peers. Journal clubs, you really dissect the journal to maximum and you can convert that into a letter to editor. Correct? Target low cost index journal and resubmit your rejected manuscripts. So to conclude, publishing research enhances the career, contributes to medical knowledge. Start with small case reports, letter to editors, and review articles which are easy entry points. Seek mentorship and institutional support to improve the success rate. And most important, to get all these things, it is this consistency. Don't leave it. One publication leads to another, and that leads to the other one, and builds your academic credibility. So we started with pursuit and to legacy. Okay, so start small, but start now. Your name grows with every effort. Your thesis is not the end point. It is an introduction to the world of knowledge. Publish not for prestige, but to push the boundaries of care. So many times the research question comes in the clinic. Half of the, if you look at, except my epidemiology papers, all others, you see something, you feel that, okay, there is no answer for it. Let's try to do a small study. Many of these, they come from clinics, and that helps to improve the care. Stay grounded, but stay hungry, and never stop reading or growing. Be a doctor who heals, a researcher who questions, and the human who uplifts. Let your achievements echo beyond your titles. Leave a legacy that speaks for you. Thank you very much. Any questions, anything you want to ask, please go ahead.
Hi, sir. So you'll be moving to the US. What is going to be your next challenge when you go to US? What is it that you're looking forward to?
At this stage, I thought it would be a new country. I have to get used to that environment and see how, because we are used to our system. So first couple of months I get used to it. But definitely I continue my work on diabetic retinopathy, on AI, and probably one new thing which will start would be IRDs, because they are involved in gene therapy. So I get involved in that. So no questions. So time is there. What we can do is, I did this in Chitrakoot recently. So we were addressing like this a gathering of PGs and fellows. No questions. So we thought that we'll rotate the mic, but without any questions. Just say whatever you want. Nothing related to this talk. Anything. And you won't believe that was a most productive session. I learned a lot. So let's start that. Couple of you.
Sir, how did you choose your domain within retina when you completed your fellowship? How did you choose your own domain being diabetic retinopathy?
Yeah, I didn't choose it. Life comes, take the life as it is coming. This is very difficult for the younger generation. I cannot convince my daughter. So nowadays the new generation is, they already think I have to do that. I did as the things are coming. So take the life as it is coming. Try to put 100% in that. So as he rightly said, trauma. Your first reaction would be no. Okay, everyday night duty. But utilize that. Do the best in that. Whatever comes in your way, everything can be. I always used to say that even anatomy, if you take anatomy as a branch, become BD Chaurasia. Everybody will read you. Or park in PSM. So none of these. So you take whatever you are doing, take the life as it is coming. And the best thing when you have choice, I used to tell my fellows, you have 4 or 5, How many of you, this is when we did pre-PG, there was one book called as Salgunan and one Bhatia. Now those books are not there. They're MCQ books. So Bhatia, the first thing they write is, if you have options, if you think all options will look correct, what your heart says first, tick on that. Correct. This is true with everything. Finding a match. No, if you start thinking everything, you will find mistakes. But what your heart says, this looks correct, just go ahead with it. Don't think much. Adopt to it.
Sir, it's a very silly doubt. Do you have any shortcut to data entry?
Yes, it is not there. Unfortunately, data entry you need to do. There is a shortcut at Shankanetrale. So EMR, everything can come out as an Excel sheet. So if you can define properly that these are the points from EMR part. So what happens, your basic demography, IOP, vision, everything can be, so you can tell Dr. Sudhir and the EMR team, if you give the numbers, all those things will come automatically as an Excel sheet, which is more than 60-70% of your work. Then only there are few things which you have to really go to the file, look into, because they are not entered. They will be somewhere in the figure. So those things. But yes, at SN that facility is there.
Sir, at our level, what should be the first journal or anything that we should aim at publishing?
Again, but as I told you, it's not the journal.
Okay,
First look into what you want to publish. So in clinic, you find some interesting case, read about it, and you find that nobody has reported that. Or it is, as I told you, those 7-8 criteria, it is rare, some very good outcome, some rare complication. Say, I'll publish this as a case report. Write the first draft and show to a consultant. So start, as I told, journal clubs. You are presenting something, it's been dissected by 20-30 consultants. Already it has so much stuff you know about it. Write a letter to editor.
So, as a postgraduate, when we go for conferences, what do you think we should actually aim at? Like at one point, multiple things are happening. It's kind of overwhelming. Like everything's new for us. So, what should we, like everything basically we can't attend also?
Yeah,
And
I agree with you. So I'll tell you how I attend RO. So when I go for a RO, it is exactly the same, because RO is a meeting which is mainly research, too many things. So you need to make your plan. So there is a program book, and it's good to make your own plan in a diary. So it's not necessary that you attend all the talks in that session. So you take, this is interesting, this I should do, this is a good thing. So make a plan for yourself. Plan also includes free papers, posters, which are it's not like cursory. If you like a poster, go and spend time with that. So if you can make your plan, do that. And at the end of the day, also note down what you learned, 1 or 2 lines about it. So that's how you should utilize. And evening enjoy. Finish all these things and enjoy.
Good evening, sir. When you are writing the manuscript during discussion, would you always get it right in the first time, or would you revise it every time, sir?
Yeah, many times. So it's not discussion alone. So how I work is like I start writing my paper from the result. So first thing I finish is, because you have already done your analysis, you have an Excel sheet. So first thing is I'll finalize my tables and figures. That's the first thing in any article. So tables and figures, like I didn't had any formal training in statistics. So what I do, I read the similar, so get all the articles which are published, divide it into high, low and middle. Not impact, how much they are similar to my article. That's the first thing I'll do. This is very much similar, this is medium. That's the first task. Then I go through their tables and figures. And every time when I'm seeing, I look into, do I have that data to make that table? That's the first thing. And besides that, what additional information I have, what I can add to it. Once your tables, figures are finalized, your half work is done. Then methods is anyway, because you have only done the study, you have to just write what you have done. Discussion comes last. So discussion is something when all of them are there. Your discussion first paragraph is what you found. So you don't have to write anything. You just put your positive result. This is what I got. And then comes all other things. Ends with strength and weakness. Definitely you should add that. Compare with other studies. Comparison table can be put, which you do when you are doing your literature search. So it goes. But as you rightly said, needs draft and redraft. But usually when I get a draft with my fellows and my optometrists, 1 or 2 drafts have already gone through. So it is little more polished.
Thank you, sir.
Great. I hope all of you will do well, and welcome to Florida to do a fellowship after finishing your VR fellowship here or any fellowship. Great.
Came late. We'll repeat for you. Thank you, Rajiv. And it's so humongous motivation that I would like to be again a postgraduate to start my career. It's highly motivational, and I had a pleasure of spending at least 25 years with him now, and to get all the points what you told is been in his blood. The same sentences he had told me when we began this career. Okay, so these things holds good, and what I can say is you could feel what he wanted to tell, that you take 2 things to him, and that your work, and he will give 4 motivational extra work for you to elevate yourself. That's the capacity what he has.